Welcome to this comprehensive clinical review of foreign body aspiration in children, proudly presented by the Pediatric Case Review channel. Today, we will utilize a case-based approach to master the diagnosis, management, and complications of this critical pediatric emergency. Our goal is to provide high-quality medical education for our viewers on the Pediatric Case Review YouTube channel. Let us begin. Here is our first clinical case. A 2-year-old boy presents to the emergency department. His mother reports he was eating peanuts 30 minutes ago when he suddenly started coughing and choking. On examination, he appears distressed with audible wheezing. What is the most likely diagnosis? Option 1, acute asthma exacerbation. Option 2, foreign body aspiration. Option 3, viral bronchiolitis. Option 4, pneumonia. The correct answer is Option 2, foreign body aspiration. The illustration demonstrates the classic triad of symptoms, which includes the sudden onset of choking, coughing, and wheezing. An acute presentation immediately after eating high-risk foods, such as peanuts in a toddler, is highly suggestive of an aspiration event. Always obtain a detailed history of any choking episode, as it is crucial for a prompt diagnosis. Case number 2 examines the epidemiology of this condition. In the Pediatric Emergency Department, you are reviewing statistics on foreign body aspiration cases. The data shows a clear age-related pattern. Which age group has the highest incidence of foreign body aspiration? Option 1, less than 6 months. Option 2, 1 to 3 years. Option 3, 4 to 6 years. Option 4, 7 to 10 years. The correct answer is Option 2, 1 to 3 years. The graph illustrates that children aged 1 to 3 years account for approximately 79% of all cases. This specific age group is at the highest risk due to their incomplete dentition, a strong tendency to explore objects orally, inadequate chewing abilities, immature airway protective reflexes, and a propensity to run or play while eating. Case number 3. A 3-year-old girl is brought to the clinic with a 2-week history of persistent cough and recurrent wheezing. Her mother mentions a brief choking episode 10 days ago that resolved quickly. Chest examination reveals decreased breath sounds on the right side. What does this case illustrate? Option 1, immediate severe symptoms always occur. Option 2, delayed presentation is possible. Option 3, spontaneous resolution happens. Option 4, chest examination is always normal. The correct answer is Option 2, delayed presentation with chronic symptoms is possible. The timeline illustration shows that approximately 17% of cases present more than 7 days after the initial event. These delayed presentations may feature persistent cough, recurrent pneumonia, or chronic wheezing unresponsive to bronchodilators. The initial choking episode is frequently forgotten or dismissed by parents, making the diagnosis challenging. Case number 4. A 2-year-old boy with suspected foreign body aspiration is being examined. You are performing a thorough respiratory examination to identify any abnormal findings that would support your clinical suspicion. Which examination finding is most commonly associated with foreign body aspiration? Option 1, bilateral expiratory wheezing. Option 2, unilateral decreased breath sounds. Option 3, stridor. Option 4, a normal examination. The correct answer is Option 2, unilateral decreased breath sounds. As highlighted in the anatomical diagram, decreased or completely absent breath sounds on the affected side is the most common physical finding. Other signs can include unilateral wheezing, bronchial breathing, and localized crackles. The unilateral nature of these findings is a critical clinical clue distinguishing aspiration from asthma or bronchiolitis. Case number 5. During a teaching session, you are explaining to medical students why foreign bodies more commonly lodge in certain areas of the tracheobronchial tree in children. Why is the right main bronchus the most common site for foreign body lodgement? Option 1, it is narrower than the left bronchus. Option 2, it is shorter and more vertical. Option 3, it has more branches. Option 4, it is closer to the esophagus. The correct answer is Option 2. The anatomical illustration clearly demonstrates that the right main bronchus is wider, shorter, and more vertically oriented than the left bronchus. This creates a preferential anatomical path for aspirated objects. Statistics show that approximately 51% of foreign bodies lodge in the right bronchial tree, compared to 33% in the left bronchus. Case number 6. You are reviewing the types of foreign bodies commonly aspirated by children in your emergency department to identify patterns. Which type of foreign body is most commonly aspirated in young children? Option 1, coins and metallic objects. Option 2, plastic toy parts. Option 3, organic materials such as nuts and seeds. Option 4, button batteries. The correct answer is Option 3, organic materials. The visual guide displays common culprits, showing that organic materials account for 80 to 90% of all cases. Peanuts and various nuts are the most frequent offenders. These are particularly dangerous because they can absorb surrounding moisture and swell, leading to complete airway obstruction. Furthermore, they contain natural oils that cause severe localized inflammation. Case number 7. A 2-year-old child presents with suspected foreign body aspiration that occurred 6 hours ago. You order a chest X-ray as part of your diagnostic workup. What is the most common radiological finding in foreign body aspiration? Option 1. Direct visualization of a radiopaque object. Option 2. A completely normal chest X-ray. Option 3. Unilateral pulmonary atelectasis. Option 4. Bilateral pulmonary infiltrates. The correct answer is Option 3. Unilateral pulmonary atelectasis. The radiographic diagram highlights that most foreign bodies are radiolucent and invisible on standard X-rays. Unilateral atelectasis or volume loss is the most common indirect sign, occurring in 27% of cases, followed by air trapping. Importantly, up to 30% of chest X-rays may appear completely normal despite an obstruction. Case number 8. An 18-month-old boy presents with a witnessed choking episode 2 hours ago while eating peanuts. He has a mild cough and a unilateral wheeze. His chest X-ray shows no obvious abnormalities. What is the next appropriate step in management? Option 1. Discharge home with reassurance. Option 2. Repeat the chest X-ray in 24 hours. Option 3. Start empirical antibiotics. Option 4. Proceed with bronchoscopy. The correct answer is Option 4. Proceed with bronchoscopy. The clinical algorithm emphasizes that a diagnostic bronchoscopy should be performed whenever foreign body aspiration is strongly suspected clinically. Strong indications include a witnessed aspiration event, classic symptoms like choking and wheezing, or unexplained focal examination findings. A normal chest X-ray never conclusively rules out a foreign body aspiration in a symptomatic child. Case number 9. A 3-year-old child with persistent symptoms suggestive of foreign body aspiration has had 2 normal chest X-rays. Clinical suspicion remains high. Which imaging modality is most useful for detecting radiolucent foreign bodies when the initial chest X-ray is normal? Option 1. Ultrasound. Option 2. Magnetic resonance imaging. Option 3. Computed tomography scan of the chest. Option 4. Fluoroscopy. The correct answer is Option 3. A computed tomography scan of the chest. The provided scan cross-section demonstrates how low-dose computed tomography can reveal hidden radiolucent objects. It is highly sensitive for detecting subtle air trapping, lung volume differences, bronchial wall thickening, and mucus plugging. However, this advanced imaging should never delay a therapeutic bronchoscopy in highly suspicious cases. Case number 10. A 2-year-old boy is definitively diagnosed with a foreign body aspiration lodged in the right main bronchus. The team discusses removal. What is the gold standard treatment for foreign body removal in children? Option 1. Flexible bronchoscopy. Option 2. Rigid bronchoscopy under general anesthesia. Option 3. Aggressive chest physiotherapy. Option 4. Postural drainage maneuvers. The correct answer is Option 2. Rigid bronchoscopy under general anesthesia. As illustrated by the instrument diagram, rigid bronchoscopy provides superior airway control, continuous ventilation, and a wider field of view. It allows surgeons to use specialized extraction instruments and effectively manage sudden complications like bleeding. It boasts a high success rate of 95 to 98%. Case number 11. A 20-month-old infant is brought to a peripheral hospital with suspected foreign body aspiration. The team is deciding on the urgency of transfer. What is the optimal timing for a bronchoscopy procedure? Option 1. Within 24 hours after stabilization. Option 2. After 48 to 72 hours. Option 3. Only if symptoms worsen. Option 4. After 1 week of conservative management. The correct answer is Option 1, within 24 hours after initial stabilization. The outcome flowchart shows that early intervention prevents severe complications such as pneumonia and irreversible atelectasis. Prompt removal reduces the inflammatory tissue reaction around the object. Conversely, delaying the procedure beyond 7 days is heavily associated with significantly higher risks, as 88% develop serious infectious complications. Case number 12. The anesthesia team is preparing for a rigid bronchoscopy procedure on a 2-year-old child. They are discussing the anesthetic approach to ensure optimal conditions. Which anesthetic technique is most appropriate for pediatric rigid bronchoscopy? Option 1. Local anesthesia only. Option 2. Conscious sedation. Option 3. General anesthesia with spontaneous ventilation. Option 4. Spinal anesthesia. The correct answer is option 3, general anesthesia with spontaneous ventilation. The operating room setup diagram highlights the necessity of expert pediatric anesthesia. Children require general anesthesia to suppress dangerous airway reflexes and ensure complete immobility during the delicate procedure. Maintaining spontaneous ventilation is highly preferred because it preserves natural airway tone and helps the surgeon identify the exact location of the object. Case number 13. A 2-year-old child had a foreign body successfully removed via bronchoscopy 5 days ago. The patient now presents with fever, productive cough, and increased respiratory distress. What is the most common complication following foreign body aspiration? Option 1, pneumothorax. Option 2, aspiration pneumonia. Option 3, hemoptysis. Option 4, bronchial perforation. The correct answer is option 2, aspiration pneumonia. The complications pie chart indicates that aspiration pneumonia is the most frequent adverse event, occurring in approximately 53% of all cases. Other potential complications include lung collapse in 20% of cases and chronic lung damage in 10%. Early removal significantly reduces these complication rates and prevents prolonged hospital admissions. Case number 14. You are conducting a quality improvement project, analyzing specific risk factors associated with higher complication rates in foreign body aspiration cases treated at your hospital. Which factor is strongly associated with an increased risk of long-term complications? Option 1, lodgement in the left bronchus. Option 2, early diagnosis within 24 hours. Option 3, delayed presentation after 7 days. Option 4, aspiration of an inorganic object. The correct answer is option 3, a delayed presentation after 7 days. The risk factor comparison table clearly demonstrates that a delayed diagnosis allows profound inflammatory changes to occur. Other high-risk factors include organic materials like nuts and seeds, lodgement in the right bronchus, and the presence of natural oils that cause severe chemical pneumonitis. Case number 15. During a community health education session for parents of toddlers, you are discussing practical prevention strategies for foreign body aspiration. Which of the following foods poses the highest aspiration risk for children under 3 years of age? Option 1, ripe bananas. Option 2, whole peanuts and tree nuts. Option 3, soft bread. Option 4, smooth yogurt. The correct answer is option 2, peanuts and nuts. The prevention checklist highlights that whole nuts, seeds, popcorn, raw carrots, whole grapes, and hard candies represent the highest aspiration hazards. Pediatricians strongly recommend avoiding these specific high-risk foods entirely until a child reaches 4 to 5 years of age. Essential prevention strategies also include cutting food into small pieces and supervising all meals. I would like to personally invite you to join our growing medical community on Patreon, named Pediatric Case Review. This dedicated platform contains all of our educational videos conveniently arranged by physiological system for easy access. All the presentation slide decks used in our videos are available as downloadable files, allowing you to easily review the material and practice the clinical questions. For subscription details, please comment below and we will message you directly. Thank you for participating in this comprehensive clinical review of foreign body aspiration in children. We hope these 15 case studies have enhanced your diagnostic awareness and management skills for this pediatric emergency. Please subscribe to the Pediatric Case Review channel for more high-yield, evidence-based medical education. If you have any clinical questions or suggestions for future topics, please leave them in the comments below. Thank you for your time and dedication.